I'm Lindsay Vestal of the Functional Pelvis. Thank you for joining me for a simple hip exploration that came from the fact that so many of my clients had trouble figuring out exactly where the hip joint is. The hip joint is this part of our body that I think a lot of us think it's along the side or higher or lower than it actually is, when in fact, it's the part of the body that when we bend back, there's a crease, right? That's where the actual ball and socket joint is. And understanding this is fundamentally important for our clients that have issues with their pelvic floor, because the hips and the pelvis have such an important connection to all of those muscles. So if our clients could better understand where this joint is, it could move more optimally for them, and they can deepen their understanding and connection to their pelvic floor muscles and their function. So I'm going to walk you through now a very simple exercise that's meant for you as a way for you to better embody your own hip complex. And if you'd like it, I invite you to adapt it to use it with your clients. All you need is some books, some paperback books. And the reason for that is because if you notice, when I lie on the floor first, if I don't have my head and neck are in a really great position. When I move my books behind me, notice how my chin and nose kind of jut back in space, right? Whereas if I put my books under my head and neck are in a much better position. So to get started, simply straighten your legs and check in with your ball and socket joint. So touch it. If you have a ball, you can gently sort of tap it, right? Just anything you can do to increase your awareness to this part of the body that gets quite quiet with all the sitting that we do throughout the day. It's quite compressed and folded, right? So now that you've kind of checked in with it and woken it up, I want you to get a sense for the space or the lack thereof that may be present in it. So just take a moment to feel any sensations or words or colors that come up in your own mind. I'll share you with mine maybe it's helpful for you. Right now, my hip joint area feels like there's not much space. It feels quite closed. It feels a bit jammed, to be honest with you. And this is a sensation I feel from time to time. But now that I'm stopping and checking, I'm really quite aware, right? So now that I've got that image in my mind, I'm going to bend my knees, and I am simply going to anterior and posteriorly rock my pelvis. So for our clients, I'll tell them pretend they have like a marble or a pebble on their belly button, and they're trying to bring that pebble or marble up to their head, and now they're trying to bring that marble and belly down to their feet, right? And I'm reminding them that they're going to notice that their head and neck is moving with this. They're not trying to make that happen, and they're not trying to not make that happen, right? That should be happening. It's a gentle reminder the body's connected, right? Just by moving my pelvis, which is the bottom of my spine, I'm moving the top of my spine. It's pretty fantastic. So I'm watching and feeling my spine shape change as I do this, right? So I'm feeling it flatten, I'm feeling it arch, and I'm really getting a sense of how my pelvis affects my spine. Pick a leg, and I want you to gently now wrap your hands around right below your knee, very gently. You're not squeezing it to you, you're not using much muscular tension at all, you're just sort of holding it. And now I want you to do that same motion where you're rocking your pelvis forward and back. Notice my knee comes along for the ride. Not trying to make that happen. It's simply a response to the fact that I am flexing my pelvis, right? Anterior and posteriorly rocking it. Still paying attention to the shape change in my spine. Still noticing how my neck and head are moving. Do this about 10 times. Then I want you to try to keep the knee still as you do that same pebble marble rocking, right? Now you're not going to actually be able to keep that knee still, and that's okay. You've got the idea. We're just trying to keep it quiet. I'm just trying to isolate the movement directly in my pelvis. So So just as a reminder, we had 3 variations of this exercise. The first variation was no knee in hand, just simply anterior and posteriorly rocking. The second variation was let the knee go along for the ride as you continue the same rock and roll in the pelvis. The third variation is do your best to keep your knee still as your pelvis does the exact same anterior and posterior rocking. Once you finished 10 of the last variation, I invite you just to straighten your legs out and check back in with your hip joint. Does it feel any different than it did when you first checked in? Is there any descriptors, any sensation, any change at all with your first check-in? The second question I have for you, is there any difference from right to left, or the side that you just moved versus the side you don't? So I'll share with you some changes I feel. I feel like my leg that I used, my right side, is actually now lower. It feels quite tilted. My buttocks actually feels flatter and more in contact with the ground. I even actually feel my shoulder blade having a more flush sensation along the ground. I also feel a sense of length and space in my joint. Like it actually feels like this leg is a few inches longer than the other side. What sensations do you have? I'd love to hear from you and how this experience affected your own body. I'm going to go ahead and do my left side now because I want to feel symmetrical. I invite you to do the same. Thank you so much for watching.